everybody, it's Dr. Kia Mitchell with Limitless Me Wellness, and I just wanted to hop on real quick today to talk to you a little bit about what we do during the consultation process. And I think it's important for everyone to know that every single consultation is going to be different. Sometimes there are concerns that patients have that we just can't address, that we just can't take care of. But for the most part, I'm going to tell you how a consultation generally goes when we are dealing with aesthetics. I usually try to start off by finding out what caused the patient to even make the appointment. Like, what is your concern? Sometimes I'll give a patient a mirror. Sometimes I'll, ask them to show me a picture of a time that they were happy. It just kind of depends on what we are talking about. But I always really want to know what brought the patient to me. And during that time, I think it's also important to gather as much information on my end as I can. So sometimes I will ask patients about their medical history. Often, when it comes to things like lasers, we need to have as much detail as possible because lasers are not for everyone. There are some people who it's not indicated for, or we might need to do some pre-treatment, or there might be some contraindications. And with that being the case, I'm always going to ask if you are currently undergoing any treatments for cancer or have been diagnosed with that. When I ask about your medical history, I'm going to ask specifically about medications. I'm going to ask about allergies. I want to know, how do you heal? So if you are a patient who has a history of diabetes or even high blood pressure, there can be a decrease of blood flow to that area. So I need to know how to anticipate how to treat you. And even more concerning is how to prevent complications. And if complications do occur, how can I take care of that? So I'm very, very detailed in terms of what I ask during the consultation process. There are some patients who, if they have a history of things like cold sores around the mouth, I'm going to want to pre-treat you. I'm going to want you to have either acyclovir or valcyclovir, Valtrex, prior to starting the treatment. And I'm going to talk to you about what we need to do even after the treatment so that we can make sure that you have a good outcome. There are some patients where we have to be a little more cautious. So sometimes people have thinner skin. As we get older, our skin does, change. And sometimes they're going to want to put you on a specific type of skincare regimen so that when we do the lasers on you, you have a better chance of it really being effective. If your dermal and epidermal layer, so that layer above the dermis, aren't really healthy, it's going to make me, maybe pause and want to wait a couple of weeks for you to have a good skincare regimen and kind of build up that layer. I also want to know about your, the way that your skin kind of responds. So I might ask you, how does your skin respond if you have a bug bite? So I'll use myself as an example. I usually have some pink or light red swelling, and I may have some itchiness there. Then maybe in a day or two, that goes away and it might leave a little brown mark on my skin. And I have had that last for weeks to months. That's not every single time. Sometimes I might be a little more aggressive if I'm scratching, but that tells me in general what I need to watch out for when it comes to a laser coming in contact with my own skin. So I want to know, how does your skin heal? So I can really be careful about causing discoloration. We call that post-inflammatory hyperpigmentation, which basically just means leaving dark spots on your skin after having a laser. And so I'm very cautious overall about how to take care of your skin so that we can give you the best results. I will also ask you, am I doing this because you are preparing for something? Are you trying to get ready for a wedding or a reunion? Or is this something where I have some time and we can space out your treatments a little bit longer? I also want to know, am I doing this for um, you in terms of a time frame where you just have one day to heal and that's it? Or is this something where you could spend the weekend inside or even, 3 to 5 days inside? Sometimes during the consultation, I'm thinking about packaging treatments where if you are concerned about your sunspots, but you're also concerned about some acne scarring, I might want to combine two laser treatments in order to give you the best results. Or we may talk about seeing how your skin responds to one treatment and then maybe adding something on the back end. So it's really important for me to know what your desires are, and so that's why I always start out with, what made you even make the appointment to come in today? Because that gives you an opportunity to tell me exactly what you're looking for, exactly what you hope to accomplish. And my goal overall is to make you feel more confident by the time you walk out of my door. So that is, in a nutshell, what we do during the consultation. Now, sometimes I'll have a mirror where, if I'm talking about a body treatment like Beautiful, where you are trying to remove fat from one place and possibly put it someplace else, I'm going to use a full length mirror so I can show you how your contour might look. And in some cases, patients have told me, actually, I thought I wanted to have one thing done, but now that I've talked to you about it, I may want to do something else. And it's really nice to offer that to a patient and give them options just from the consultation. Usually, we come up with a plan together. If it's something regarding, your face, neck, what have you, I'm usually going to want to recommend some sort of skincare regimen to go along with what you're doing, or even replace what you're doing. And we'll talk through how to maintain. So sometimes patients come in, they do a package of three. I see them those, 3 months or 6 months, what have you. But how do we maintain it? Because once we finish that treatment, your skin is going to continue to age, and certain factors are going to make it age even faster. So I may say, we'll finish this treatment in 3 months, and then I'll follow up with you again 3 months after that has completed. But what are we going to do at that point? Are we going to just say, oh, this is how it's going to look and that's it? Or are we going to have a plan where I see you every 12 months, every 6 months? It just depends. So I'd like to have very detailed consultations. Sometimes it may be a little lengthy, but the easiest way to give you the best results is to know what you're looking for up front and to be able to tailor your needs accordingly. So please don't hesitate to come and see us. Limitless Me Wellness in Jacksonville, Florida. Our number is 904-204-9355. And please hit the subscribe button below so you can hear all about what we offer. Have a great day, everyone. Bye.